Thank you very much for waiting, and now we would like to start the keynote speech. First, I would like to present the presenters. And first, serving as the chair, Mr. Sadayoshi Tobai, Director of the Secretariat Office of WWF Japan. And then the presenters or speakers of these keynote speeches. First one is Dr. Osahon Enabulere, President, World Medical Association, and Dr. Raphael Lagans, President, World Veterinary Association. So I would like to hand it over to Chair Mr. Togai to proceed the session. Yes, thank you very much. I'm working for WWF Japan. I'm Sadayoshi Tobai, Director of the Secretariat Office. It is an honor for me to serve as the moderator of this keynote speech session. One Health, health of human, animal, and ecosystem. In order to achieve the health of these living things, we need to work together. So that is the topic that is repeated again and again from the beginning of this meeting. So the leaders from these three major disciplines, we have invited them to give us a keynote speeches. And then from their perspective, what kind of thing we have to do as the next step towards the future, that is the topic of the next session. Health of humans. I think the World Medical Association is the association of the specialists thinking about the health of humans. So Dr. Osafon Enabulere is president of WMA. And we have Dr. Raphael Lagans, World Veterinary Association, that is the Association of Specialists in Veterinary Medicine. And then another presenter, that is Doreen Robinson from the United Nations. First, we're going to have the keynote speech by Dr. Osafon Enabulere. Dr. Osafon Enabulere is now the president of WMA. And then also he is just is the president of Commonwealth Medical Association, and then the former president of Nigerian Medical Association and the joint coordinator of Coalition of African National Medical Association. He is very enthusiastic in just taking an approach towards One Health, and then the One Health perspective from the World Medical Association, that is the title of his talk. So Dr. Osafon Enabulere, please, now the floor is yours.
Thank you. Good morning.
マイクの確認していただけますでしょうか。
Would you please just check the microphone?
Good morning, everyone. I want to say that I'm extremely delighted to be before you here today. But first, I want to recognize the presence of very important dignitaries here present. Importantly, the governor of Fukuoka Prefecture, His Excellency Sitaro Hattori, and I want to recognize his presence amongst other dignitaries here present, including our mentor, leader, Dr. Yoshitake Yokokura, a past president of the World Medical Association. I recognize every other person here present. My name, as you've heard, is Dr. Osahon Enabulere. I'm currently the president of the World Medical Association. I'm here to add to the discussions for today's very important theme centered on One Health. And I'm going to be talking about the perspectives of the World Medical Association. In other words, One Health and the perspectives of the World Medical Association. For some of you who may not know about the World Medical Association, the World Medical Association is a global federation of all physicians in the world. and currently has over 115 national medical associations and attends to the needs and welfare of over 10 million physicians currently. The World Medical Association attends to issues that border on health system strengthening, the issues of medical ethics, for which the association is very profound in terms of its ethical constructs. Of course, we also dwell on the issues of physician rights, well-being and welfare, and the rights of patients, amongst others. But importantly, we seek to advance universal access to healthcare. I therefore want to say that I will, in the next 10 to 15 minutes, the time allocated for my presentation, look at this very important concept of One Health and see what more we can do to advance it. In other words, I'm going to dwell more on some practical realities to, of course, advance One Health. Now, having stated this, I'd like to proceed to now to do this presentation, really, I shall focus on certain ingredients. I will try to set the scene, which I've already tried to do, really. Look at some basic definitions. Of course, introducing again to some of the benefits of One Health. A look at some of the challenges and barriers to One Health. And if you like, some progressive, purposive way forward for us to advance One Health in terms of looking ahead. And I hope to end up with a conclusive aspect of my presentation. So this is the outline I intend to use for my presentation today. And just to set the scene, I would like to say that the concept of One Health is not entirely new. In fact, before One Health started, I'm sure a lot of us have been practicing One Health one way or the other, either in terms of human health, animal health, plant health, or environmental health. But again, the world had to come together to formulate a collective agenda to advance One Health, and that was just a little over a decade ago. So it is not entirely new, but what has really driven it to a point of prominence in the last over a decade ago was the whole rise in emerging and re-emerging infectious diseases, particularly zoonotic diseases, the pandemics, of course, the epidemics, and so more importantly, the COVID-19 pandemic, which has helped to refocus the world on the need for us to come together again to drive the concept of One Health. So what I'm saying here is that I'm going to be preaching to the converted, really, because I believe all of you here know what One Health is all about. One Health is that concept that galvanizes all sectors, all disciplines, trying to connect again human health with animal health, plant health, environmental health, and of course, to have a balanced ecosystem. Over 200-300 years ago, and I'm sure some of us were living 200-300 years ago, but some of us who were not around then, you can go into your history books, and the world was such a pleasant place. The world was a place where everybody lived to, look forward to living in. The animals were peaceful with themselves, the humans were peaceful, there was balance, of the ecosystem. But something happened along the line. There was an invasion of our biodiversity. And of course, with the encroachment of even animal kingdoms, the wildlife habitats, on account of human activities, of course, the erosion of our biodiversity led to some complications and some untoward effects that we are all not trying to contend with in terms of the increasing, new and re-emerging infectious diseases as a result of the bridge in the contact between animals and humans, as a result of the erosion of our ecosystem, environmental changes, climate change, and all of that. So all these relationships that used to exist in a very balanced form has been substantially distorted. And that has led to what we are battling with in the world today, where every time we are thinking of what next to do to, of course, prevent global health threats, to prevent animal, diseases, and of course, to save our environments. In some countries of the world today, there's tremendous flooding activities going on in Pakistan, in Nigeria, and other places, all as a result of the climate change issues, as a result of human activities and erosion of our biodiversity. So it is important that we understand this. There's increasing human population, of course, with expansion into new geographic areas. People have to find where to settle in, and sometimes they have to go into animal wildlife environments to create new habitats for themselves. And that, of course, narrows the distance between animals and humans, and, of course, easily leads to the spread of diseases. Deforestation activities, the whole issue of industrialization and urbanization. Structural poverty. Poverty has been one of the drivers that has led to increasing erosion of biodiversity and, of course, fueled this whole concept of diseases, whether animal, human, or environmental. Then, of course, the whole concept of international trade and travels. With globalization and movement from place to place, from country to country, easily done these days as a result of technology, and of course with plants and animal migration, is that risk and that tendency for us to have more disease affectation of humans. And so I say that the erosion of our biodiversity brought in its wake challenges of environmental pollution, climate change with food security, human and animal health increasingly threatened. And that is the reality we face in today's world. Nobody is safe anymore. And that is why we preach that unless and until everyone is safe, no one is safe. And that is, again, the whole basis for the One Health concept. Now, every year we know that millions of people and animals around the world are affected by zoonotic diseases. And of course, there are several of them. I did not think I should waste your time on this. But of course, some of them are readily known to us. Just recently, the World Rabies Day was celebrated as part of the One Health agenda. And of course, that was a collaboration between the World Medical Association and the World Veterinary Association. We issued a joint statement on this because that still is an issue, even though you may say it's more in the developing countries of Africa and others. Of course, foodborne infections, diseases, vector-borne diseases, and others are still plaguing us till today. And of course, the recent COVID-19 infection. And so the One Health concept is actually what you may consider a reflection of a global quest to reconnect us again in a balanced ecosystem. And that brings in the interplay of professions, disciplines, and various sectors. It is a collective, collaborative approach to drive better health outcomes, not only for humans, but for our animals, and of course, even secure the environment and our plants and our ecosystem. Now, in terms of the definitions, we all know what health is. But do we know what One Health is? Even though One Health concept was launched over a decade ago. I just say there's still a lot of poor awareness and information about what even One Health stands for, even amongst professionals. But the good news is that just recently there was a great attempt by a quadripartite platform made up of the World Health Organization, the United Nations Environmental Programme, the World Agricultural Organization, and of course the Food and Agricultural Organization of the United Nations. They set up a high-level expert panel on One Health that has been working in the last 1 year to develop a better platform and framework for One Health. And they came up with this definition. So this definition is not my definition. It is a definition that was released just a month or two ago by the One Health high-level expert panel. And you can see it's very comprehensive. It states that One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. Balance and optimize the health of people, animals, and ecosystems. So it's a comprehensive attempt to secure our future, to secure the health of citizens, animals, and of course the ecosystem. Now, it recognizes that the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. This again was provided by the high-level expert panel of the quadripartite. Now you can see what they try to depict here in terms of the relationship between environment, human and animal. In other words, a balanced ecosystem as we used to have in the days of yore, where everybody was living happily. You were not scared of anything. You were not scared of even diseases. But everything has been distorted. And so how do we come back again to that natural existence and world. It is through collaboration, through coordination, capacity building, and communication. These are some of the graphic illustrative views of the One Health high-level expert panel. But we shall go beyond this when I look at the way forward in advancing the One Health agenda. Now, the approach mobilizes sectors, disciplines, and communities at various levels of society to work together to foster well-being and tackle threats to health and ecosystems, addressing the collective need for clean water, energy and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. You can see, again, it's very comprehensive. You may begin to ask, what else are we going to be doing in this One Health agenda? Because everything is here. It is a complete package. Now, in summary, it is a collaborative effort of multiple disciplines working across sectors at local, national, and international levels. So beyond Fukuoka, what are we doing at the international level? To achieve optimal health for humans, animals, plants, and our environments, including the ecosystems. In other words, no one person, no one discipline, no one sector can achieve One Health. We all need to come together to advance our conversations and, of course, plan actively to advance One Health. Now, the World Medical Association, which I currently superintend over, some time ago in 2012 signed a memorandum of understanding on One Health with the World Veterinary Association, and I'm happy the president is here also. And we have been jointly carrying out some activities to promote the One Health agenda. Every time One Health is celebrated globally, both associations issue joint press statements. And we are also working at lower levels to advance the One Health projects. The WMA has been strongly advocating the deployment of One Health approach for health system strengthening, reduction of the risk of infectious diseases, and of course, the global fight against the menace of antimicrobial resistance. Are there benefits of the One Health agenda? Of course there are. There are so many, but I will list just a few here. It helps us to reduce wastages by efficient alignment and deployment of resources. So you can imagine if everybody was to be doing his own thing, there may not be progress. There will be movement, but there will be no forward advancement. But with everybody coming together to secure global health and prosperity and future, you're able to conserve resources. You're able to align them properly, and of course, leverage on even other existing platforms. So it's important to understand that it also saves wastages. It also helps to prevent epidemics and pandemics. Of course, the reduction of risk of infectious zoonotic diseases through effective prediction, prevention, early detection, management and control of zoonotic diseases, epidemics, and pandemics. In fact, this is one of the real benefits of the One Health agenda. How can we more effectively predict disease threats even before they happen? How can we, even after predicting it, control and manage it, or even prevent it from happening? So what kind of global surveillance systems do we have on ground in terms of global surveillance mechanisms? The One Health agenda is supposed to be an answer to that. Of course, the global fight against antimicrobial resistance. Today, one of the major challenges of the world has to do with the antimicrobial resistance. A lot of strains are developing to advance antimicrobial resistance. How can we help to, of course, solve this problem? To promote animal growth, people use all sorts of antibiotics. Even for human health, a lot of antibiotics are abused, and over time, we are now confronted with the whole challenge of antimicrobial resistance. The One Health agenda seeks to address this fight against antimicrobial resistance. Now, are there challenges that we need to be aware of? I will say yes, there are challenges. And this is without prejudice to all efforts that have been made so far. And let me, on this note, congratulate again the Fukuoka Prefecture Administration for showing the way and leadership in the One Health agenda. So like Fukuoka, I'm sure many others are also working hard to advance One Health, including the World Health Organization, and even the quadripartite that recently launched the joint action plan on One Health in October last month. But with all of this that has happened in Fukuoka, in other places, are we really moving forward in advancing One Health? I'm sorry to disappoint you. My assessment suggests that not much seems to be happening collectively in terms of achieving the very objectives for which the One Health agenda and approach was adopted. But why is this so? It may be so because of certain barriers and challenges. And some of them you already know. Because for those of us who operate more, profoundly and prominently in terms of human health, the challenges confronting human health are not really different per se from that confronting animal health. Ditto, even the environment. There are some cross-cutting issues and challenges and barriers that we need to be aware of. And some of them will include the issue of political commitment. We're happy people like Setaro Atori have strong political commitment. Can we say same of many other leaders in many other countries? We still are not there in terms of basic health system strengthening across most countries. We saw how COVID-19 pandemic exposed the fragility and the weaknesses of most health systems across the world, even in those countries we thought were had the best of health systems. Why was that so? Because people were not planning ahead. So the issue of poor political commitment is one that has stultified the growth of the One Health concept. In my country, for instance, I have my experience. In other countries, there are varied experiences. And even at the launch of the Joint Action Plan recently, that was last month, it was very clear that the issue of political commitment needs to be addressed if we must make headway. We need more of Hattori across the world to be able to, of course, showcase and advance One Health and promote global health security. There is the issue of low awareness and poor uptake of the concept. This is also very real. We are here discussing One Health today, and I congratulate the organizers for organizing this. But please, all across the world, I can tell you, even amongst professionals, not many may understand what One Health is all about. Yes, human health, you know, animal health, you know, but when they tell you One Health, people are ignorant, people are unaware. So how do we improve awareness? How do we empower the people with information? How do we communicate One Health to the people, even to professionals, to be able to drive the One Health concept? So as we plan, as we congregate, as we organize, let us understand that even the citizens need to understand what One Health is all about. So there's still a lot of work to be done to advance One Health beyond the political commitment that we require. There's also the challenge of weak multidisciplinary and multi-sectoral collaboration. Before now, we were talking about One Health in all policies. That has not even been achieved. Now we have One Health to be mainstreamed into all sectors and all disciplines. What is the level of cross-sectoral collaboration? What is the level of multidisciplinary collaboration? Yes, we collaborate with the World Veterinary Association, but can we say that of other disciplines? Because it is beyond just doctors and the veterinary surgeons. The ecologists, the environmentalists. Do we have a common aggregating table to advance the concept of One Health and work together, even research-wise, to be able to advance a more futuristic direction for the society? So these are issues. We also have the issue of insufficient financing. Not much is to be said in this direction. I do not want to bore you with figures. I like to be as practical and as simple as possible when I talk to audiences. But the challenge we have in today's world is that not much is happening in financing healthcare, not to talk of One Health. Now, there's poor investment in research. You Google today, you ask yourself what researches are being done even in the field of One Health. What data, what information are we sharing? Do we have a common platform for sharing information on One Health? All of that we need to address. Now, sorry. Okay. Now, because of time, I would like to quickly look at what I think we need to be doing going forward, because the whole presentation I'm making from what asked to do is to look at what perspectives can we as an organization advance to further One Health. And I'll do that very quickly before my time runs out. Now, I dare say that the lessons learned from the COVID-19 pandemic, which was very devastating, you all know that it affected nations, communities, citizens, and even professionals. A lot of them lost their lives. And at every opportunity, I say, may their souls continue to rest in perfect peace. So, the fact that we, in our generation, saw this level of devastation should prompt us to know that advancing One Health has even become more an imperative. It is not something we need to doubt anymore, but we must now begin to look at what more practical options can we explore to advance One Health before the next pandemic comes. There is therefore need to translate concept to action. And for those who know me, I'm an action man. I do not believe that we have to continually talk about talks, but we must walk the talk. How can we walk the talk of One Health beyond eternal conversations, beyond gathering on global tables? How can we get down to the roots, to the streets, to the roads, to the communities, to preach and do what One Health is all about? Are there ways, therefore? I say there are several. And the first point is to see how we can get many more authorities in terms of increasing this political commitment of governments across the world to One Health. When the Joint Action Plan was being launched by the quadripartite, there was a lot of lamentation about the inability of most governments to commit themselves more effectively to advancing One Health. If we did not have the likes of Atori, and I'm sorry I have to keep mentioning him because I was so happy with what I was told today, you will not be talking about One Health. So we need many more political leaders to have this on their table and to be reminded every time on the need to invest more in the One Health agenda. Because if they don't do that, we're not going to see the benefits of One Health. Tied to that is the need to continually strengthen the health system. There are several areas of the health system we still need to continually address. Because if the health system is weak, then all the talk about One Health will end up in nothing. So how do we, even in a post-pandemic era, because the world is transiting to a post-pandemic era. Yes, I know a lot of people are still wearing face masks here because of the challenges currently being faced. But the truth of the matter is that everywhere I go in the world, I see people trying to go back to their normal states. But in doing that, how do we get people to know that we do not need to relax on our, rest on our oars and continually invest in the strengthening of our health systems, to build surveillance systems, to build pandemic preparedness systems for our countries, our nations, to be able to, of course, avert another pandemic or even better manage it. And so there is need for public enlightenment and advocacy. Beyond signing agreements, we need to be able to continually advocate to governments, even to the citizens, on the beauty and the benefits of the One Health agenda. Are we doing that just now? Your guess is as good as mine. How can we more effectively mainstream the One Health agenda in all policies, in all sectors? That is still an agenda we need to drive. When I go to environment, do they talk about One Health? When I go to telecommunications, do they talk about One Health? Because we've talked about advocacy here, public enlightenment. So we need to, again, look at how we can effectively mainstream One Health agenda in all sectors, in all policies, and continually track it. It is not enough to sermonize it. We must track it and make sure it is being done. Of course, sustainable financing is, it needs no emphasizing. You need money to be able to drive any programmatic action. And so let's see how we can get people to understand that any investment in One Health is a reasonable investment. And so nothing can be too much to invest in the One Health agenda. How do we improve collaborations beyond veterinary medicine, human medicine? How do we get others to the table and also collaboratively advance One Health? That beyond the World Veterinary Association and the World Medical Association issuing joint statements, can we next year have many more ecologists, environmentalists, and others even join in that MOU to advance the One Health agenda? Beyond press statements, can we at the grassroots level begin to work together in this whole concept of One Health? Of course, we need to support even the healthcare workers who are working in this direction. We need to improve research, data, and information sharing. Even the conduct of research, we need to improve on it on One Health. We need to be able to see evidence, real-time evidence on what we are doing on One Health and how we are contending with the challenges through One Health approach. What is the evidence just now? Not much is available. Of course, the undergraduate and postgraduate curricula, for the WMA, this we take very, very seriously, because if we do not address it at the beginning, at the point when people are coming in, then of course they may grow into adults or graduates with poor knowledge about the One Health concept. And so we can better inform people and better advance One Health if at the very beginning in the curricula of schools, not necessarily medical, yes, medical, postgraduates, medical, even other disciplines at undergraduates, postgraduates, and even at college levels, inculcate it in the curriculum. So for Kwaka, if you do not have that already, I think that is one point that can be, of course, advanced beyond this conference, that as a way of building future generations that will implement One Health, can we have it at the undergraduate and postgraduate curricular level? There is a need to continually have comprehensive surveillance mechanisms, and of course, promote the sustained fight against antimicrobial resistance. The World Medical Association is very profound on the issue of antimicrobial resistance. We have a beautiful policy on antimicrobial resistance, which we can make available to any institution, any government that wishes to, of course, leverage on it. Because like I said, the whole issue of antimicrobial resistance is one issue that is challenging the world just now. A lot of abuses of antimicrobials, either at individual level or even at animal level. We need to be able to, of course, contend with this. There are a lot of DNAs, a lot of genetic changes, mutations that have resulted from this whole abuse of antibiotics, that even the germs of today are telling us that they are resisting us. How can we manage this more responsibly? Of course, the whole issue of indigenous production of vaccines, pharmaceuticals, and of course, other consumables is very important. The whole COVID-19 experience taught us a lesson. And I do not want to go into the issues that came up at the very beginning of the COVID-19 struggle, where there was vaccine nationalism over other products, and there was no global solidarity. We need to avoid this. And the whole concept of global solidarity, again, comes to mind here. And last but not the least is the issue of capacity building. We need to build capacity of everyone, especially the professionals, on the whole concept of One Health and the various methodologies for advancing the One Health agenda. There are a lot more that we need to do. But let me say that the COVID-19 pandemic, as I said before, truly exposed the fragility and the weaknesses of health systems across the world, with tremendous impacts on global security and the health, psychosocial, economic, and political life of nations and citizens. I have been asked to talk about the perspectives of the World Medical Association. I did not come here to speak like a professor, but I came here to give you real, practical facts that we have generated from the streets. The platforms of the enemy, of the WMA, the platforms of engagements, because we need to walk the talk and not continually talk. And so I therefore want to say that having realized the immense effects and impact of the COVID-19 pandemic, which we are trying to still recover from, for us to achieve a healthy and sustainable future for all. And I can see how all of you are looking so beautiful. But we want the next generation also to be very beautiful, even much, much beautiful, and prevented from the challenges that we currently face in terms of health threats, pandemic, and epidemics. And so I therefore say that for the world to achieve a healthy and sustainable future for all, there is need for greater commitment to the One Health concept, with investments in integrated and resilient health systems that can secure human, animal, plant, and environmental health. On that note, let me thank all of you for this opportunity once again. I hope I have not bored you. I'm a very practical person, and I want to thank the leadership of the organizers of this forum, the Fukuoka One Health International Forum, and of course the leadership of the Japan Medical Association for making it possible for me to be here. I've been traveling for a good number of days, and for the first time, I experienced something this morning, but I told myself I needed to be here to make this presentation too. I've traveled from Malaysia to Geneva, to Sweden, and of course now in Fukuoka in the last couple of days. And I want to say that I thank God for making it possible for my body and my spirit to be with you today. And I look forward to even future engagements with Fukuoka, with Japan, and of course to advance the One Health concept to further our common prosperity and our future. And I want to say that at the level of WMA, we shall always be available and ready to further this. Let me also thank my wife and family who have tolerated my absence this number of days. It's not easy, but we thank God, and I hope we can see again. Thank you very much. God bless you all.
エナブレラ先生、ありがとうございました。ワンヘルスを推進するために非常に重要なポイントがある。そのコンセプトだけではなくて、アクションにつなげるためには、それがなくてはYou
need to make sure that One Health should be promoted by actions. And he has shared with us important actions. One, as he repeatedly mentioned, is the importance of a strong political commitment. On the other hand, this should also be supported widely by the citizens. So this is number two. The third point, as he has repeatedly emphasized, you need to have cross-functional and cross-sectorial endeavors. Number four is the budget. You need to secure budget to implement the actions planned. And you have the accumulated data and results of research and studies. So we hope to have further discussion on these points later on. Now I'd like to invite our second speaker, Dr. Raphael Lagans. He is president of WBA. He assumed the presidency in March this year. From 2011 to 2017, he was a representative of Europe for WBA. He is going to talk about WBA's initiatives on One Health and future perspectives. Please.
Good afternoon. Oh, excuse me. Good afternoon, everybody. It's a pleasure to be here in Fukuoka. Dear Governor of Fukuoka Prefecture, it's a pleasure to see you again after yesterday. We have in the same room. I am start to be in love of this town, of this prefecture. After these days, I have been passing here and seeing all is have been done here. Congratulations also to the citizens of Fukuoka for having this. And Dr. Osahon Ena Bulele, thank you very much for being here. And also thank you for your words. You make part of my work easy. I just want to start to tell you that I agree in your proposal, in your analysis to take actions. And my intervention, even we are not talking what we are going to talking each other, but is going to be a little bit complementary with yours, because I try to dip a little bit more in the idea of One Health. I am president of the World Veterinary Association. The World Veterinary Association is an association of different associations of veterinarians, and we try to be the voice of the world veterinary profession, the global voice, and we try to promote animal health, animal welfare, and public health, and doing that through leadership, advocacy, and networking. These are our strategic priorities. As you can see, One Health is the first one, veterinary education is the second, animal welfare is the third, and pharmaceutical stewardship are the fourth, including in pharmaceutical stewardship, antimicrobial resistant fight that my previous speaker, the previous speakers have mentioned, the president of the World Medical Association say, antimicrobial resistance is the silent pandemic, the future pandemic, if we don't take care of them. And of course, we need to have a good partnership and visibility of the work that we are doing. The global veterinary network is very important, and in this network that we are working, of course, World Organization for Animal Health, FAO, the Food and Agricultural Organization, the World Health Organization, and as you can see here, the World Medical Association is very important for us, as many others. I just mentioned some of them, that we need to work together in this intersectorial effort, interdisciplinary sector that I have mentioned before. Still, when I go to many meetings of One Health, I hear something like, oh, it's very interesting, this new concept. And the question is really a new concept? Well, the father of the medicine, Hippocrates, mentioned in one of the treatises on earth, water, and places, he mentioned what is the interaction between, that means in the 4 centuries before Christ, he mentioned the interaction between the air, the ambience, and the health of the people and animals. That means that it's not that new, even if we, of course, at that time, they don't mention that One Health, but the concept is here in the world, in this treaty. And also, several centuries after, in the 19th century, Virchow mentioned that between animal and human medicine, there are no dividing lines, nor should be. The objective is different, but the experience obtained constitutes the basis of the medicine. That means the concept of One Health was known since many centuries ago. But one thing is the concept, another is the reality. What is the reality of One Health? I want to share with you this article of Science from 2020, where in this report mentioned that measles virus and rinderpest virus diverged to 6 centuries before Christ. That means that there was a virus, a bovine virus, common ancestor of the modern strains of rinderpest virus. Rinderpest is a disease of cattle that was disappeared, as I mentioned a little bit after. This ancestor virus of bovine was an ancestor common for rinderpest and measles virus. That is a human disease, and that was circulating during the 4th millennium before Christ among the animals. It might have some contact with humans and cross the barrier, for sure, in several occasions, but because the human population at that time that was limited, this virus died was simply a host. But as soon as the human population grows, like in Babylonia, that was more or less 500,000 people, then the virus entered in the human and stayed as a human virus, and that created the measles disease. That means the reality of One Health is since the beginning of the human civilization. And also, some people say, I recently heard a journalist in one of these meetings telling, well, this concept of One Health is a little bit abstract and people doesn't understand very well. Then another famous Greek philosopher, Aristotle, was part of the academia of Athens in the 387 before Christ here. And he was the father, he was not only an important philosopher, but also was the creator of the biology, zoology, embryology, and science methods. And he did that through observation of the Hippocratic Treaty that I mentioned before, but also in the information about simple people like fishermen, shepherds, hunters, beekeepers, simply observing the reality. And also he created comparative medicine and unveiled as much as possible the nature. That means that the medicine and the science, the beginning of the science was really not that abstract, was simply, if we observe the nature, we can see what happened. When the veterinary profession was created scientifically, that was in the Royal School of Lyon in 1761, you can see in one picture Claude Bourgelat, that was the creator of this school, working with physicians, doing dissection of horses. That means, since the creation of the scientific profession, as we know, the veterinary profession, we were working together, physicians and veterinarians. And in the right picture, in the very same year, this year, 2020, we can see the Center of Surgical Research in Zurich, in University of Zurich. And in this institute, with this modern room of surgery, you can see veterinarians and physicians working to make advance the surgery for the benefit of the humans. That means, since the beginning, human veterinarian and human medicine and veterinary medicine, we have worked together. In 1860s, there were a plague. There was what they call a plague, a devastating disease that was covering main part of Asia and Africa and Europe, that was called rinderpest. That was a bovine disease that was creating a lot of mortality and also creating economical disturbance in this society. And that was the issue that may create the very first International Veterinary Congress in 1863 in order to try to find rules to fight against diseases, epidemics that were going from one country to other. That was the beginning of the first International Veterinary Congress and also the beginning of the World Veterinary Association. Many years after, in 2011, finally, through the collaboration of all the countries, led by the World Organization for Animal Health, we finally eradicate this disease. That means that it's possible to eradicate this kind of diseases. It's very difficult, take a lot of time, but it's possible. And that disease that was rinderpest, that was the first animal epidemic disease that was eradicated, but there is another disease that is eradicated also, in this case in the human side, that is smallpox. That was eradicated in May, was declared eradicated in May 1980. That gives us a hope that this kind of diseases as COVID-19 could be with the time and with the collaboration be eradicated. And I put this picture that I like very much, is vaccination center that is from the Museo of Prado in Madrid. Is vaccination center in which you can see a doctor putting the vaccination of the smallpox in a boy, in a girl, and there is a vaccine because there is a cow, because you know the word vaccine comes from vaca, that in Latin means cow. That means, again, it's another example of the interconnection between animals and humans. And after this pandemic, after this example that I mentioned at the beginning, between measles and rinderpest, in 20th century, after we have another example of interspecies transmission of viral pathogens, involvement of environment, urban, rural, wild, in development of this kind of disease. That was SARS pandemic from 22 to 23. And that was not far away from here. That was in the Pearl River Delta, where there is Hong Kong and this big conglomeration. Again, is the combination of our civilization, the way humans we live in different areas, and also the interconnection of the virus between the nature, between the animals and humans. And in this work done by some Chinese scientists, they mentioned the coordinated global response. The research strategy and methodology development can be applied in response to future emerging, re-emerging infectious disease. That was in 2002, 2003. That was not possible to use this information, to use this knowledge to fight against the pandemic we are suffering now. I hope in the future we can learn of that and go to the action as the president of the World Medical Association said before. And just to emphasize the importance of this concept of One Health, just this is a graphic of our work in data that mentioned the distribution of the biomass of mammals on the earth. And as you can see, humans, we are only at 34% of this biomass of mammals. Livestock and pets is 62%, and wild mammals 4%. That means if we see a planetary global, we are a small part of this mammals biomass. And that gives an example of the importance of taking care of the health of this biomass to protect each other, animals and humans, how interconnected we are in this planet. But not only at planetary level. If we see our own homes, we can see that we live very closely with our pets. In many countries, as you can see here, in some data, most 3/4 of the population in many countries of the world consider their pet animals as dear family members. And then, and for sure, there is this close interconnection must to be taken consideration with human physicians if they need to ask if the people have a pet at home and register in the records. And you can see the distribution is not only dogs, cats, birds, fish, and others. This is, and only in these 24 countries of this survey was done, only 43% of the population have no pets. Again, just to emphasize the importance to take care of our animals and vice versa. This is the coincidence that I have with Dr. Osahon Enabulele. I agree with him that this is the best definition of One Health, and this is that one created with a One Health level, high-level expert panel. Then he mentioned before, I just simply emphasize that I totally agree on that also, and we need to take care of all these points that is, and communication is very important again, as he mentioned. We are in a dialogue, clear dialogue and direct dialogue between a physician that just talked now and a veterinarian that I talk in this moment. But I believe that the human and veterinary medicine is essential to continue to make an in-depth dialogue. These are 4 physicians that were fighting against COVID-19, and they are putting the finger like this, telling that they unite to the movement One Health, One. That means these physicians have suffered the distress of the health systems that we suffer because the COVID-19 pandemic. And they suffer, and still are suffering, our health systems because this pandemic. That means we need to think on them, to prevent and to avoid the suffering of these health cares, but also the million of people that have died, that have suffered for COVID-19 pandemic, and the people that even in some countries couldn't have this kind of attainment. Then it's very important, and that is an example. These physicians know now that they suffer that because one health problem was not tackled before in advance. The dialogue. There are two pictures of the Global Conference on One Health that we did together, the World Medical Association, the World Veterinary Association, and the veterinary associations, and the Veterinary Medical Association and Veterinary Medical Association from Spain and from Japan. The first global conference was done in Madrid in 2015, and the second one, and I had the honor to organize this conference, and the second one that was in Kitayusu, Japan in 2016. That was the second global conference. And this second global conference have very nice consequences that we are living here. Is all the actions that the Fukuoka prefecture have done regarding the initiative of, I think all of this is a global example for all of us, was mentioned with my predecessor, because the politicians need to take action. And I think the prefecture and a municipality is the political institution that is closer to the citizens. And I think the citizens need to push, need to request the politicians to offer them the possibility to have health environment, health animals, and health humans. As mentioned before, this is the ordinance of the prefecture of Fukuoka regarding the improvement of the One Health. And again, I think it's a good example that other politicians, other citizens need to see and follow. I tell you that sincerely. I was very happy to be here and see this reality. What we do in our organization specifically, some of our initiatives are, as I mentioned before, this One Health Global Conference that I want to tell to the president of the World Medical Association, we need to repeat again. We have been done 2, and after the pandemic, as soon as possible, we need to do the 3rd One Health Conference. I have been talking with the people of your office, and probably Brazil could be a good opportunity, or could be a good chance, but we can do in front of the Fukuoka governor this commitment that we are going to do as soon as possible the 3rd One Health conference. Our citizens deserve that. Well, what we are doing is, we are, as a veterinary medicine, one of the things that we want to make a statement, a global statement, to declare that the veterinary medicine, that the veterinary profession is a health profession. Because what we are talking during this intervention demonstrate that this is a health profession. Then it's one of our projects. In my presidency, we are going to, with the help of everybody, to be considered as a health profession. The second one is we are going to create the One Health Veterinary Awards between World Veterinary Association and CIVA Santé Animal. We have a working group on One Health that is working in different statements. And of course, as I mentioned before, we need to repeat as soon as possible the 3rd Global Conference of One Health. And very close to here in Taipei, Taiwan, in 4 months, we are going to have our World Veterinary Association Congress in 26 from 29 of the next year. The theme of this Congress is All Life is Precious, as we mentioned during the 2 interventions, the life of the environment, the life of the animals, and of course, the life of the humans. Hello. Well, and in this conference, in this Congress, we are going to have a summit, a One Health Summit, that we are continue working, talking, and trying to make actions about One Health. That's all. Thank you very much. And I join the proposal of my predecessor to continue and to pass to the action. But we need to have clear which are the ideas, what is the philosophy, what is the concept to get to the action. Thank you very much.
Thank you very much, Dr. Yes, during the pest and measles or other pandemics, yes, the physicians and the veterinarians, they have been working together. The collaboration that has been just doing even in the past, particularly in the past in Spain and in Kyushu, the global conference in One Health that is held already twice in the past, and third global conference, we would like to just have this one soon after the end of this pandemic in collaboration between WMA and the WVMA. Thank you very much.
From the specialist perspective, we're going to have a talk by Ms. Doreen Robinson. She's going to talk by video.
Thank you so much to the Fukuoka Prefecture and the organizers for having me here today to share some of UNEP's work and perspectives on One Health. The world is more interconnected than ever before. Our connections bring us both opportunities and challenges for the health and well-being of humans and all the species we share this planet with. A healthy planet is a prerequisite for healthy people and animals. The triple planetary crises of climate change, biodiversity loss, and pollution and waste threatens our quality of life, livelihoods, health, and well-being. Climate change and the unprecedented droughts, floods, heat waves, and other impacts cost lives and damage human health, on top of the economic losses that further exacerbate health problems and our ability to recover. Nature and biodiversity loss are degrading ecosystem services vital to human health, whether it be the provision of clean water, diverse and micronutrient-rich and healthy foods, and medicines. Untreated waste and pollution from industrial mining and agricultural activities, oil spills, toxic dumping, they're destroying habitats and poisoning the air and water. Air pollution is killing millions of people each year. Approximately 60% of human infections originate from animals. The estimation jumps to 75% for new human infectious diseases. Drivers of the spillover include climate change, unsustainable agricultural practices, land use change, ecosystem degradation, and unsustainable and illegal wildlife trade. Humanity's relationship with nature is currently broken, and it is driving up our health risks. But by acting on these environmental issues, we can protect human health and reduce the pressure on healthcare systems. One Health is an approach that allows us to do just that. One Health is not a specific thing to do, but rather an approach to a complex problem of securing human, animal, and environment health. Recently, the G7 and G20 have issued declarations in support of One Health. In 2017, the UN Environment Assembly passed a resolution on environment and health to reaffirm the strong interlinkages. And again, in March of this year, another resolution was passed at the 5th UN Environment Assembly, where 193 countries passed a resolution on biodiversity and health and called for the need to break out of silos and to work more collaboratively, including managing and reducing spillover risk, strengthening regulation in wildlife trade, enhancing collaborative biotechnological research, and supporting antimicrobial resistance actions, among other areas. Earlier in this year, the world's leaders showed bold leadership through the UN General Assembly resolution recognizing the universal human right to a clean, healthy, and sustainable environment. These are just some of the global foundations for strengthening a One Health approach. But calling for something and doing something is a very different thing. Our collective challenge is to realize and operationalize the approach on the ground in tangible ways that have impact, the very things that you'll be discussing for the next few days. In March 2022, UNEP formally joined the Quadripartite Alliance for One Health, alongside the Food and Agriculture Organization, the World Health Organization, and the World Organization for Animal Health. An important starting point for delivering on the promise of One Health is making sure there's a common understanding of what is meant by the concept, an understanding that fully embraces the interconnectedness of all spheres of health. Recently, with the support of the Quadripartite's One Health high-level expert panel, a new definition was developed and endorsed by our 4 organizations, and I share that definition now. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. It recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. The approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems, while addressing the collective need for clean water, energy, and clean air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. With this new definition in mind, UNEP is working to strengthen the environmental dimensions that have lagged behind some of the human and animal dimensions. More specifically, One Health discussions have largely focused on the prevention and control of a very limited number of infectious diseases at the human-animal interface. Our aim is to ensure that we fully understand and act on the overarching drivers of health risk, a wider body of risks, including climate change, land use change, and environmental degradation. The Quadripartite recently launched the One Health Joint Plan of Action, and there are 6 areas that we will be focusing on working together. This includes One Health capacities for health care systems, emerging and re-emerging zoonotic epidemics, endemic, zoonotic, neglected tropical and vector-borne diseases, food safety risks, antimicrobial resistance, and of course, strengthening the environment. UNEP, along with other partners, has also recently launched the Nature for Health initiative. Through an initial contribution of 50 million euros from Germany's International Climate Initiative, it brings together leading UN agencies, intergovernmental organizations, and civil society groups in the field of environment and health. This new initiative focuses on investments in nature as a basis for reducing the risk of pandemics. The partnership takes a preventative approach, looking at the drivers of risk. The fund will help countries achieve more holistic policymaking by creating further evidence of the specific links between biodiversity, climate, and health, and focusing on preventative actions. It will support decision makers and relevant actors to take measures to prevent future pandemics. In the Asia-Pacific region, UNEP has also been actively engaged in other initiatives related to One Health. UNEP has supported countries in the region in enhancing readiness and rapid response systems for zoonotic pathways and risks. For example, assessments on the status of biosecurity systems and measures were conducted in India, Laos, and Vietnam in 2021. Also in Vietnam, UNEP has undertaken a review of regulations on markets where live animals and meat are traded. The assessment highlighted the need for further promoting a One Health approach and for improved implementation of regulatory and legal frameworks to manage risk in a holistic manner. UNEP is also supporting the project Safety Across Asia for the Global Environment, known as SAFE, in close collaboration with the UN Office of Drugs and Crime and FAO. This EU-funded initiative focused on mitigating the risks of new zoonotic diseases within wildlife keeping facilities and markets through risk assessment, application of risk mitigation measures, and supporting a regional policy dialogue. UNEP has been facilitating and contributing to the regional level dialogues and processes on One Health in the region. For example, we co-convene the Asia-Pacific Regional Forum on Health and Environment with WHO, under which the Manila Declaration on Health and Environment was adopted in 2016. UNEP has also collaborated with the Economic and Social Commission for Asia and the Pacific, the International Institute for Environment and Development, FAO, and WHO in facilitating the interactive policy dialogue on Environment Health Nexus in Asia and Pacific, which was held in September of this year. The outcomes of the dialogue are focused and are being used as a foundation to guide strengthened science-based policy, which is under development. From all this work, let me highlight a few challenges we face. Challenges that, when we overcome them, will provide tangible co-benefits to improving health outcomes for all. Challenges that we can turn into opportunities for the future if we work together and if we work better. First, we have to deal with the root causes behind changing health risk profiles. I began by describing the complex systems that drive health. We need to better generate evidence that unpacks these complex risk profiles, including understanding how climate change, land degradation, and other factors are influencing health risks for all species. For example, we know that many pathogens are sensitive to temperature, rainfall, humidity, and other factors. And we know that climate change can drive shifts in agroecological zones. We know that species will respond to these shifts, including the human species, by movement and sometimes migration. And we know from COVID that factors like air pollution negatively affect the severity and recovery of people who did contract a particular disease. We also know that fragmentation and connectivity can affect pathogen transmission across species for some diseases. And we know that anthropogenic factors are changing land use and the interactions of species, again, including humans, driving up novel interactions that could increase the risk of contracting disease. It's a very complex system. We all know that. We need more science and evidence, however, using such systems analysis to unpack these dimensions. And we need that evidence to be brought into policy and decision-making in meaningful ways, which leads me to my next point. We need to invest more in prevention. The multisectoral and transdisciplinary approach of One Health will also help to identify a more holistic and comprehensive set of preventative actions. And that leads me to my last point. We have to avoid the unintended consequences of decision-making. And here I'll talk again about zoonosis and wildlife trade. We know that wildlife trade, particularly unsustainable, unregulated, and illegal trade, does pose some risk for transmission of zoonotic disease. But we also know that wildlife trade is a source of livelihoods, income, and food security for millions of people worldwide. And in turn, these benefits can further incentivize conservation and maintenance of healthy ecosystems. But in some cases, there's been a call for halting wildlife trade to be considered as part of breaking the chain of disease transmission. It could be an important part, but it has to be considered in the context of its potential implications for other spheres of health. For example, experience from an Ebola outbreak in West Africa in 2013 to 2016 demonstrated that public health messaging on the dangers of wildlife meat completely contradicted real experiences felt by people in villages. As a result, the proposed bans on wildlife trade were not only ineffective, but in part led to a proliferation of informal meat networks that made surveillance even more difficult. I'm oversimplifying a very complex situation, but my point is that by not taking an integrated multi-sectoral approach to One Health in this particular case, the responses were both ineffective and had unintended negative consequences. In 2022, FAO reported that the expected benefits of One Health to the global community is estimated at least $37 billion per year. The estimated annual need for expenditure on prevention is less than 10% of those anticipated benefits. So the evidence is clear. We cannot afford to not implement a One Health approach. So with those thoughts in mind, I hope that these next few days of your discussions will be fruitful, and I hope you will share your outcomes widely. I hope you will find ways to lend your expertise to enhancing this global community of practice. One Health is not easy to implement, but it is a critical part of moving us towards achieving sustainable development and the future we want, a future of living in harmony with nature. UNEP stands committed to work with all partners, and thank you again.
We have just heard from Dr. Doreen Robinson from UNEP. We also heard from Dr. Anna Buleva and Dr. Lagwens. I think we have some common threads. At G7 and G20, when the leaders get together, they have repeatedly emphasized the importance of One Health. This was mentioned by the three speakers. And in order to take actions, you need German budget and EU budget. And with those supports, each country needs to be prepared and take actions. And for that, you also need individual state budget. She also mentioned about the complications of this issue. You need to identify the source, the origin, and various pathways. And she mentioned about the importance of the research, just as Dr. Inabulele and Dr. Langens mentioned. So today we have the president of WMA and president of WBA, and repeatedly the keyword what we heard is Fukuoka. I think I counted more than 10 sightings of the term Fukuoka. Fukuoka is now making much advancement here in Japan, in Asia, and also in the world. And I think the two speakers on the stage have emphasized the fact that Fukuoka is taking a lead. And with this, we'd like to conclude our keynote session. Thank you very much for your kind attention. And let's give us a big round of applause to the two speakers on the stage. Thank you very much. President WBA, WMA, thank you very much for joining us.